Welcome to the Myeloma Matters podcast, hosted by the Multiple Myeloma Research Foundation, focusing on patients' experiences with and perspectives on multiple myeloma topics that matter to anyone affected by this blood cancer. In this episode, you'll learn what being a cancer survivor means, why the concept of survivorship is important to patients living with myeloma, and tips on empowerment, advocacy, and day-to-day aspects of a patient's journey. You'll also hear from MMRF Patient Navigators, Erin Mensching, Allison, and Brittany Hartmann, who'll share resources for accessing up-to-date information on living with myeloma. They can also help patients find communities to connect with other patients, caregivers, and myeloma experts. Please note that every myeloma patient is unique. The information in this podcast is not intended to replace the services or advice of trained healthcare professionals. Please consult with your healthcare team or contact the MMRF Patient Navigation Center at 1-888-841-6673 if you have specific questions about your health. If you'd like to support this podcast series, we'd love for you to leave a comment or review wherever you get your podcasts. Cancer survivorship isn't determined by how long a patient has been cancer-free. The term casts a wider net and includes everyone who's ever had cancer. All multiple myeloma patients are survivors, no matter where they are in their journey. To put it another way, a patient is a myeloma survivor as soon as he or she gets a myeloma diagnosis. There have been many groundbreaking advances in myeloma treatment in recent years, which means that more patients are living longer with myeloma. This is certainly good news, but because myeloma also has a significant impact on day-to-day life, it means that it's more important than ever for myeloma survivors to learn to navigate these challenges. In addition to the impact of myeloma and myeloma treatment on their physical, mental, and emotional well-being, myeloma survivors must also learn to cope with how their disease affects their personal and professional life, as well as the various impacts of living with it. These include undergoing monitoring for relapse or late treatment side effects and screening for secondary cancers, which often require coordination of care across a variety of primary care and specialist providers. In light of all this, the framework for myeloma patient care has shifted towards not only treating the disease, but empowering patients to thrive in their survivorship by focusing on their total health, wellness, and quality of life. Treatment advances in myeloma mean that there are not only more treatment options, but more types of therapy than ever before. This is, of course, a very good thing, but it can make the process of managing myeloma less straightforward. A number of options are available for each line of treatment. Treatment efficacy, potential side effects, and their impact on quality of life can affect a patient's ability to stay on treatment, and these factors all play a role in the decision of which treatment to use. In many cases, cost needs to be considered as well. As myeloma patients and their healthcare teams navigate the available options, patients are encouraged to participate in the discussions. This process, known as shared decision-making, allows patients to communicate their goals and ensure that their survivorship experience is in line with their priorities. For many patients newly diagnosed with myeloma, treatment advances have led to extended periods of clinical remission. The standard of care at this stage is induction therapy, followed by an autologous stem cell transplant for eligible patients. However, postponing the transplant, particularly for patients with standard-risk myeloma, is a reasonable choice. Maintenance therapy is then used to deepen responses and maintain clinical remission for as long as possible. Standard induction therapy typically involves a combination of 3 drugs, called triplets, or 4 drugs, called quadruplets. The backbone of these combinations is usually a proteasome inhibitor such as Velcade or particularly for patients with high-risk disease, Kyprolis, along with an immunomodulator, for example, Revlimid, and the steroid dexamethasone. If a fourth agent is added, it's usually an anti-CD38 antibody like Darzalex or Arcellx. Although these are the standard approaches, they are not the only options. Your healthcare team can work with you to determine if a more or less intensive regimen is needed based on your myeloma risk factors and any comorbidities you have that would affect your ability to tolerate treatment. The decision to proceed to a transplant involves the consideration of many factors, including your overall health, the availability of a caregiver, the need for recovery time, infection prevention, and your preferences. If you or your healthcare team are unsure about proceeding to transplant after induction therapy, you can choose to have your stem cells collected and saved so that you'll have the option to move forward with a transplant in the future. After transplant or after induction therapy, if a transplant is skipped, maintenance therapy with Revlimid is often used to increase your length of time in remission. Sometimes Revlimid is combined with Darzalex or another drug. This often helps delay relapse, but as with any treatment, there can be some bothersome side effects. If you're receiving maintenance therapy, you should talk about potential side effects, how they can be prevented or managed, and what steps can be taken if they become intolerable. Even with all the treatment advances that have been made, multiple myeloma remains an incurable disease, characterized by cycles of relapse that require further rounds of treatment to achieve disease control. In addition to the therapies used for newly diagnosed myeloma, a variety of new agents, including CAR T-cell therapies and bispecific antibodies, are available for patients whose myeloma has relapsed or become refractory. If your myeloma is in early relapse, you will likely receive a triplet regimen that contains at least one drug that you haven't previously received. Some CAR T-cell therapies have also been approved for treatment of early relapse. The many treatment advances in myeloma have nearly doubled survival rates over the last decade. This work has been the effort of many different clinical studies, which have led to the development of treatments that are safer, more effective, and help improve survivorship. There are hundreds of ongoing clinical studies still working to investigate new drugs, new modes of administration, and novel combinations to help people living with multiple myeloma. At any point in their disease course, patients can discuss with their doctor whether a clinical study is right for them. Available studies may also include observational ones, which study how myeloma changes over time to better understand the survivor experience and disease progression in different groups. You and your caregivers should take the time to learn more about myeloma, available treatments, and how your health is monitored. This can help you better understand the options your care team proposes and empower you to weigh the pros and cons from an informed position. Patient Navigators with the MMRF can help so that you and your caregivers can feel confident you have the most reliable and up-to-date information about myeloma and myeloma care. The Patient Navigators can also connect you with resources to address other concerns related to myeloma treatment, including mental health resources, financial resources, and tools for navigating insurance. We'll turn now to the members of the MMRF Patient Navigation Center, who will talk about the resources that are available to help you better understand how to achieve the life you want with myeloma.
Hi, Grace and Brittany. Thank you for joining our podcast and helping our listeners understand myeloma survivorship. We returned from the Oncology Nursing Society annual meeting earlier this year, inspired by this really great topic since it was the focus of several presentations at the meeting. There's this really great shift towards really incorporating quality of life and thriving and living as best as possible with myeloma. So Brittany, I was wondering, can you share with us what is survivorship and why is this important?
Thanks, Erin. So yes, survivorship really emphasizes the health and well-being and quality of life of people living with cancer. So we're going to discuss a few important topics related to survivorship that will empower patients to shift from suffering and fighting their myeloma to hopefully living and thriving with myeloma. So survivorship starts at diagnosis, and it really takes a more holistic approach to living life with myeloma. So one of the concepts of survivorship we had wanted to discuss today is shared decision making. Patients are often told that they need to be more involved in their care, especially when it comes to treatment decisions. However, many patients aren't sure that they're equipped to make the treatment decisions and rely mostly on the advice of their doctors. So we want to make sure that we are empowering patients to really be a part of their care team because they really are the central part of that.
Grace, what is a way that we can help patients understand that it's not only just the treatment decisions that they have to make, but rather being able to know what their preferences are and to communicate like key milestones maybe that they have in their life coming up to help them make these good decisions that align with their treatment and life goals and their personal needs?
We feel like we really encourage patients to mention those when you're having the meeting with your physicians, when you are meeting any of the care team. If a plan of care runs up against some prior plans that you had, such as a life event like a daughter or son's wedding or anything of that nature, a graduation, something big, to have that conversation with your care team and see how can we adjust the plan to incorporate these important timeframes in people's lives. It's very important to be able to have that time and with your family. This is a long-term thing because this past decade has brought really significant changes in the treatment of multiple myeloma. Even the data right now, the 5-year overall survival rate is at 61%. And that data actually is it's about 4 years old already. So there's a lag between what we have on paper and what we are seeing. So what we're saying is that there's a long-term marathon approach to care for a patient with multiple myeloma. While there may be some urgency in the beginning, we can take time to incorporate life goals as we go forward. We have heard physicians mention this more than once, that it has become more of a chronic illness at this point because we have people surviving and thriving so long with multiple myeloma. And so we can compare it to maybe a disease such as high blood pressure or diabetes. You're going to see your specialist on a regular basis. You're going to have treatment ongoing for your life, but there's going to be a time when it's not going to be such a major part of a person's life. So the side effects, though, however, can be ongoing. And so this is part of the survivorship that we're going to be talking about, dealing with the side effects in a way that people can continue on treatment, and then if side effects are long-term, how to deal with them even after therapy finishes. So that's an important part of helping people maintain a good quality of life.
And I know that you, Grace, and Brittany both answer a lot of questions about side effects of treatment, and you always encourage patients to speak up for themselves and talk about these side effects so that they can feel like they are part of the decision-making strategy. And if they want to stick with a current regimen, or maybe if they want to take something for their side effects, or maybe there's some tips that they can learn. So this is great. So thank you for reminding us of that.
I always encourage, again, since survivorship starts at diagnosis, many medications that you're on can cause certain side effects, and then the remedy may be to do another medication. But I always, remind patients to speak up early, because you could do something as simple as a dose adjustment, and that may minimize the side effects while also still managing the myeloma. I always say the care team really wants to, do best by the patient, but they can't do that if they don't know what's going on. So another thing about, empowering yourself is making sure that you're speaking up about these side effects when you experience them.
Yes, thank you for that reminder. That's a great reminder.
And it is a two-way street. The physicians and the team expect that there's a two-way conversation. So we encourage patients not to go in there and expect just to hear from their care team, but to understand that the care team are expecting to engage in a conversation, that it's a two-way street.
So Grace, do you want to maybe share with us what could this look like for a newly diagnosed patient to be part of the shared decision making?
Yes, certainly. So for a newly diagnosed patient, if a newly diagnosed patient was to contact us, the patient navigation department, we have a model that was put in place by our founder, Kathy Juicy. This is a myeloma patient who 25 years ago had to figure this out for herself. How is the best way to approach this really new challenge? And most people, when they are diagnosed with multiple myeloma, have not even heard of it before. It's a brand new term, it's a brand new disease, and so we understand there's a lot to get up to speed on. So the model that we use, and again, it came from Kathy, but we have a right track model where we start with helping the patient to access the best possible care team that they can. And what does that look like? We encourage multiple myeloma patients to access a myeloma specialist. So that may be somebody that they would not see as often as their local hematologist, oncologist, but certainly a specialist. We found that the outcomes are much improved when a patient is able to be seen by a specialist. And then also the next part of that right track is having the right testing and then getting on the right treatment. And you asked for newly diagnosed, Erin, and there is in every case a standard of care, thankfully, in place now for myeloma, but there's also an option we like to mention out the gate to consider a clinical trial, especially if you're able to have a specialist that's in a larger academic setting. They may already have an appropriate clinical trial in mind, and they may give that information to you. So we like to make sure people are understanding and not be surprised if a clinical trial is an option for them. But otherwise, the standard of care for a newly diagnosed in the United States right now is to have a period of what we call induction. So induction is either 3 or 4 drugs combination, and that is usually given in cycles, and that will be 3 to 6 cycles. But the physician may have a conversation right in the beginning about whether that person is eligible for a stem cell transplant or not. And this decision, again, in order to make an informed decision, the patient has to have all the appropriate information. And that's not something that a patient, we understand, can do overnight or in a week. It's a lot of information. And so taking their time to understand all of the risks and benefits of everything they're presented with is important, so people don't feel rushed into something. But transplant will be brought up early for a newly diagnosed patient, especially if a physician feels they're eligible. So there's lots of factors that go into being considered eligible for a stem cell transplant. It's not just age related. We look at overall health of the patient. We look at their what is considered frailty. So how strong is that person? Have they been through other health challenges such as cardiac disease or lung disease? After we've considered whether a person is eligible or not, then they will proceed, if they are eligible, with the harvesting and the stem cell transplant. And once that has taken place, usually you'll see that take place in the first year of a newly diagnosed myeloma patient's experience. And after that, then we can usually see them transition to a less intense time. And this phase is called maintenance. And so the standard right now for maintenance is either a 1 oral drug that you take as maintenance, but some patients who have a high-risk disease may see more than one drug for that maintenance time frame. And so that maintenance is a time where the disease is being watched to see, has it remained stable? Is it still responding, which we would see happen after the induction and transplant? And continually being in contact with your care team. Again, this is a lifelong disease. We know that while it's not curable, we do have therapies that can be used, but it is an ongoing monitoring situation.
Thank you, Grace. Thanks for sharing that about the newly diagnosed patients. And I know there's a lot of decisions to make. We do encourage patients to ask the decisions and ask the question, why? Along the way, it never hurts to ask, why is this the treatment for me? Why is transplant appropriate for me? And ask those questions so that you can feel a part of that making of a decision. So Brittany, now that we've gone over newly diagnosed patients, what about a patient who is relapsed or maybe has been on therapy longer? What can you tell us about shared decision making for those people?
Sure. So although myeloma technically is, still incurable, I always like to tell patients that it is very much manageable. Like Grace had mentioned earlier, the shift of managing it like a chronic illness has really become, one of the main ways that patients and physicians try to deal with, this disease. But when you are first diagnosed, it's pretty laid out, that roadmap there of what to do, the standard option. Once you get to, the point of a relapse, because unfortunately it is an anticipated part of the disease, you hopefully remain in, remission for quite some time on that maintenance therapy, but it is always, a potential that you will hit a relapse. But the goal of the shared decision making is that you have a plan laid out for when that happens already. So there are, many different options of therapies, which is great. But again, that can sometimes put the ownership back on the patient of what is best for me. So that's why having these conversations with the care team about all of the options that you have. Again, standard of care, and as Grace mentioned as well, there are clinical trials. So there are so many options available, and the way that you choose really, again, is up to you and what fits into your life at this point. There's going to be some that you need to be there weekly versus every other week, and how are the side effects going to affect my day-to-day functioning and living? These are all things that you can, lay out. I always encourage patients, when you're given, say, 2 to 3 options from the doctor, make a list of pros and cons for each of them so that you can have it written on paper and be able to visualize it and bring that to the doctor with you so that you can really talk about the real life considerations with these therapies. You want to be able to go for a hike or go biking, or be able to see your grandkids, and if you're on something that's a higher risk for infection, little kids have germs and this and that. So there's different therapies that may put you at higher risk for infections. Though there's the CAR T is one and done. That's a great option for some people. There's bispecifics that eventually you may be able to be less present in the infusion center, and then you've got your other options that have been here for a longer time, such as the monoclonal antibodies, such as Arcellx or Sarclisa, all different kinds of combinations. And it's really up to you to choose what makes the most sense for you.
Thank you for sharing that. I really like the idea of a pros and cons list. That's a great tip. Thank you for sharing that.
And as we find, we learn so much from our patients. Just came across this yesterday, when we have the conversation with the patient often is, what's going to happen next? And we know this. And I often say to them, the physician has a plan. Most of the specialists and myeloma specialists that we talk with and hear from, they say that they have a plan, even if it's tentative in their mind as to what will happen next should another line of treatment be required. But what does that mean? How can I personalize that for myself as a patient? Is it okay to include location? Is it okay, like Brittany mentioned, to include whether or not I'll have a caregiver available to me if I was to consider a CAR T for a relapsed patient? So looking at the pros and cons list and taking our time and considering a person's goals of care, that's all very important, so they're confident with their decision moving forward.
And then other things to consider too, how frequently do you have to be in the infusion center? Do you have the capability to drive yourself, or will you need to arrange a ride? When you're going in for, say, a transplant or CAR T or even bispecifics, when you're first starting those out, you have to be in the hospital. Say you have pets at home. Is someone able to take care of them? There's other things outside of the disease that are important to you as not just a patient, but as a person, and you want to make sure that all of those things are being well thought through. So, again, the CAR T and transplant, both, as Grace mentioned, requires a caregiver. Do you have someone who is able to be there pretty much full time for an extended period, typically a few months, I would say at the minimum, while you're in that real recovery period? People who can, help you with the household tasks and cleaning, maybe do your grocery shopping and cooking for you, all things so you can really, as a patient, focus on your recovery. So, again, when the doctor is giving you options, though there are many, many standard of care, this is really a time that I would say they do focus and present you possibly with clinical trial options. Survival rates have nearly doubled in the last decade, and that's mainly because clinical studies have led to the development of treatments that are safe and effective and that produce fewer side effects and that lengthens lives. I always say we wouldn't have the standard of care options that we do have today, and so many of them, if it weren't for participation in clinical trials. So, the importance of that Multiple Myeloma Research Foundation, that's at our core. We really support these trials and want to make sure that any kind of misinformation about a clinical trial is cleared up. Sometimes patients are concerned about, oh, well, I'm a guinea pig, or I'm going to be experimented on. And that's by no means true. They are so rigorously monitored. I would say even sometimes more so than the standard of care, because those have been, around for much longer. These clinical studies, so they may require you to have a bit more blood work, possibly biopsies, imaging. So the thought of, being again, a guinea pig or an experiment, you're actually being monitored so very closely, because that data is very important to find out if, these therapies are working. And if at any point on this trial you are experiencing severe side effects or it is not working for you, you would immediately be taken off of that and then offered a standard of care option.
And part of the Multiple Myeloma Research Foundation, over the years, they've devoted over $500 million into these researches and over 100 clinical trials. And it's accelerated the development, just like you said, of these new therapies. In the last 5 years, we have so many more options that we didn't have years ago. And again, it's led to a tripling of the life expectancy for a patient with multiple myeloma, which is all such good news. But it comes down to researching, and a lot of the time when you see a clinical trial for multiple myeloma, it's comparing an arm or a group of people who are getting a standard of care approach to a standard of care plus or minus something like a new agent. So they're very carefully structured, but it does lead to understanding more about this disease and how we can get a best response for our patients.
And even if you were to consider, a standard of care option, we've even seen those are considered interventional studies. So there are also studies that are called observational studies, and those are really the ones that are incorporating these quality of life considerations. So they want to look at, management of side effects and are you able to do your day-to-day. So even if you wanted to choose possibly a standard of care option, that you can talk to your provider about, are there any kind of quality of life, consideration trials? And that's another option, again, because the more that we learn and that we know, we're able to better assist patients in really achieving their overall care goals, which again, our goal and mission is a world free of myeloma and to accelerate a cure for each and every patient. But along the way, we want to make sure that as a person, your quality of life is as high as it can be.
Yes, and that's why I really like this topic of survivorship, is because it looks at each person as an individual. So not just, you're not just a myeloma patient, but you also have a life to live. And so that brings me to ask, what are the different quality of life aspects, staying on treatment, maybe some of the things that come with the side effects, that maybe you could share with us, and maybe there's some tips around that you can share for our audience.
Yeah, so there's a lot of different things, and again, I like to view it as you're a person first and a patient second. So as a person, how do you support yourself? General overall health and wellness is really important, to anyone, but especially if you're, working through a disease process or side effects of certain medications. There are things that you can really do to support your overall health, such as nutrition, exercise, sleep regimens, and managing fatigue. Also quitting smoking, light to moderate alcohol intake, and probably one of the biggest is minimizing and eliminating stress, which we all know can be easier said than done, but finding stress relief activities such as walking, meditating, yoga, it could be cooking, music therapy, breath work. There are so many things, and you have to find what's a good fit for you. I know that a lot of times we'll get questions on what is the best diet for me to follow. And really, we like to say it's everything in moderation. That will refer to nutrition, that will refer to exercise, to rest, to really anything in life. Is if you're feeling overwhelmed, kind of press pause and try to assess, what is it that I can do to recenter myself right now? So there's a lot of, again, alternative therapies and more holistic approaches that really have become a focus. I know where I worked previously, they actually had a holistic nurse that you could consult with that would kind of look at everything full picture. We also had nutritionists on staff that could help with those questions because, as we mentioned, everyone is very individualized. Not only is your myeloma very individualized, but your specific needs will be very individualized. So making sure that you're utilizing all of these resources, which again, if you're at a larger center, they usually offer these types of activities to help, again, with stress management and just really optimize your overall general health.
That is so interesting, Brittany, because having the opportunity to visit with teams such as a survivorship clinic or a holistic nurses is wonderful. They're not everywhere yet, unfortunately, but when we mention holistic care, what we're meaning is that we know that all of us are more than one-dimensional. We do have psychological aspects, we do have physical aspects, we do have emotional aspects. So how are we as the medical community looking after that whole person? Are we considering all of that? And like you said, It's very encouraging to see the medical community move away from less of treating the disease, but treating the person, the whole person, and the disease is just part of it. So again, that keeping that in mind helps the care team to tailor the treatment to that person. If they're having side effects that someone else is not having, being able to have that conversation. Can we dial back on the frequency of the drug? Can we lower the dose of the drug? But having that conversation so that that person is doing as well as possible, able to have some control over their feeling as well as possible on the day-to-day while they have this condition.
Thank you. So that really is a good reminder for patients to speak up so that they can share what's going on for them and be part of that plan for their myeloma.
And to your point, Brittany, on staying on treatment and long-term health maintenance, it's important that we mention to our patients that they need to continue following up with other doctors. If you have a doctor who monitors your heart, keeping up your appointments with them. Also, as we age, there are screenings that we need to continue, like mammograms or prostate screenings. So keeping up with your general health is important so that you're overall just as well as possible. And if there are side effects such as fatigue, having that conversation with your physician, they may need to refer you to another specialist. Perhaps after transplant, we've seen sometimes thyroid can be affected. So an endocrinologist may be a good consult for a person dealing with fatigue. Sometimes an endocrinologist can find that after transplant, a patient has a problem with their testosterone. And so tweaking other health systems will help a person feel well overall. So bearing that in mind, I think it's important to mention.
That's a good point, Grace, because I think that patients also, become so focused on the specialists, the myeloma specialists, but might not understand or realize that certain side effects and management of certain side effects may not fall actually under the scope of the myeloma specialist. So for example, you have kidney involvement with myeloma quite frequently. You may be referred over to a nephrologist, or if you are post-CAR T or bispecific and unfortunately experience that neurotoxicity, that may be a time to refer over to a neurologist and make sure that, any symptoms and side effects that you're having are fully worked up. As important as it is for you to be seeing that myeloma specialist, it's also important that any other symptom or side effect, if it's not deemed to be related to the myeloma or something that is a typical side effect or symptom of the myeloma, you may have to anticipate having other doctor's appointments and consults to manage and keep up with. So the importance of that, I'm really glad you mentioned that, because it is something that sometimes, patients don't really anticipate, and it can get overwhelming with having multiple doctors, but it is very important. And to treat yourself as a whole being, as a whole person, it's important to make sure that you have the right eyes on each individual sign and symptom that you may be experiencing.
These are great reminders. So keep up with your regular other healthcare screenings, your regular physical every year, and maybe your healthcare team, as Grace and Brittany had mentioned, will incorporate not just your myeloma specialist and a primary care provider, but maybe a nutritionist or a physical therapist or a neurologist. So your healthcare team can really be all-encompassing and very supportive for you. So thank you for those reminders. So Brittany, we talk about empowering patients through gathering knowledge. What do we need our listeners to know about this? And maybe if you could share a few questions that patient can ask their care team in order to help them decide on a treatment plan that is best for them.
Yeah, of course. So this is, as you both know, Patient Navigation Center. This is one of kind of our core values and focuses is to really prioritize the patient and empower them through knowledge. So we can get someone who, again, is newly diagnosed and has never heard of myeloma before. So I always like to take an approach of let's learn about the basics first. And again, one of those things is it someone that is treating you who really knows what all of your options are? So empowering yourself starts with making sure that you're getting a specialist on your team, because they can help guide you through this, this empowerment through knowledge as well. We're here as an additional resource, but making sure that you're, educating yourself on the different lab tests, the diagnostics, even what is myeloma. It's, a disorder of the plasma cells. What is a plasma cell? There are so many different things that you need to learn to be able to then make, again, those decisions on what type of treatment is right for me, what kind of sequencing is correct if you get to that point of a relapse. And you want to just make sure, again, if you're trying to make a treatment decision, to weigh out those pros and cons, because that's a way that you are able to empower yourself and say, I've learned about this therapy and I've learned about that therapy, and this may work well for me and that might not. And that's how I'm going to come to this decision. And again, involving your caretakers and your support system, making sure that they're educated as well. We at MMRF have so many great educational materials. I really like to think that we've done a good job of trying to meet the needs of everyone learns a little bit differently. Would you prefer to pick up a full booklet and read that front to back? Would you rather have something that you could quickly reference? So we have our things like the fast facts. If you want to learn about one particular topic, we have webinars. If you'd like to, listen like you are today, a podcast, you don't have to necessarily be glued to your computer. You can listen to this on the go. So we really try to make sure that we are able to provide patients with up-to-date, high quality, and reliable information, because that's how, as a patient, you're able to, again, be part of this informed decision making. So some questions you may want to ask is, what is the best treatment option for me? What side effects do I need to consider with this treatment plan? How can I manage these side effects? Thinking long term, if you are possibly on one type of therapy, but those labs are slowly starting to go up, how can we make a plan forward so that we're not scrambling at that moment? We can already have something in place. And again, those types of questions, are a clinical trial, is a clinical trial a good option for me versus the standard of care? What would the clinical trial entail? Some people don't, realize that if you're on a clinical trial, you may need to be at that site. So if you're traveling long distances to get to your specialist center, is that something that's feasible for you to do, to participate in a clinical trial versus, again, those standard of care options that you may be able to get with a local physician under the guidance of that specialist? So these are all questions that, as a patient, may be going through your head. And again, I think it's great when a patient has a journal that really has all of the information, just something to be able to frequently reference. So one thing that you can do is, be your own advocate. Don't be afraid to speak up. You're not bothering the team. We can't treat you as a person if you're not, letting us know what side effects and symptoms you're having. It's vitally important to make sure that you're relaying all of this information, because there's no way for you to have that additional support from the healthcare team on how to manage this if they don't know. So making sure that you're speaking up for yourself and letting, the care team know is really important.
Okay, so as we know, coping with a cancer diagnosis of any kind can really be very overwhelming. So just to talk about the mental health aspect and There's a lot of fear and anxiety and distress that can come along with not only the diagnosis, but throughout the whole kind of journey. So I was wondering, Grace, if you could share with me some strategies that maybe patients can use to manage their mental and emotional health.
Sure. So, like you mentioned, a lot of the overwhelming time frame is when somebody is initially diagnosed. It just feels like sometimes they have communicated with us that the rug has just been pulled out from underneath them. And so there's a whole lot that they're going through in terms of questions and trying to find information. So one of the things we help people with is guiding towards reputable information, some good information sources. That's not the time to get on a Facebook conversation thread, because that is not going to be your source of really good, solid information. Our founder, Kathy Juicy, wrote a book, From Fatal to Fearless, and she has some 12 steps in there that are really useful. And again, it talks about going to a reputable source, going to cancer.gov, going to the Mayo Clinic website, going to places that's going to give us some really good, up-to-date, evidence-based information so that we can understand what are we dealing with and what do we need to do going forward. So getting good information is important for a person's mental health because it gives them back a certain amount of control, of feeling control. But bringing in your care partners is a very important part of this too. And if possible, to rely on more than just one person. You may have to have several people who are part of that support team. You might have someone who drives you to your appointments, or you might have someone who does the research for you, or you may have someone who just brings meals to your house, somebody who takes care of the kids. But spreading out that caregiver burden, that's a useful approach, because that way all of the pressure is not just on one person, because it's overwhelming for the entire family, not just the person who's initially diagnosed, but the entire family of course is drawn into this. When we have people contact us at the Patient Navigation Center, I would say we talk to almost as many care partners as we do patients, because sometimes they take ownership of the fact-finding part of this. So getting support in that way, loved ones, friends, and there may be a time when we're getting better nowadays of recognizing that it's important to say when you're really struggling mentally that you're dealing with overwhelming anxiety or even depression symptoms, and then bringing on board a professional, a therapist or a counselor. And there are lots of people available. So contacting us at the Navigation Center, we're a listening ear. We're here for one-on-one support, but we can also find you a professional that you can talk with. For some people, support groups are a great opportunity for that support. Talking with us is talking with people who've never experienced it, but in a support group, you're going to meet patients like yourself who are going through the same challenges, and they've met some of the same side effects. They've met some of the same, again, logistically problems, such as what do you do for care for your child, or what do you do for any number of challenges, like how do you get transportation to your appointments. So having somebody locally who've gone through this and been through that step already is a great way to talk with support groups, getting that information from them. And then, like we said earlier, taking time to engage in things that brought you pleasure before this all began. So hobbies and activities that brought you joy, that distracted you, listening to music, reading a book, taking time for that self-care. That will relieve some of that pressure so that you're not constantly thinking about and dealing with this. And then balance is very important. If you find yourself 3 hours down a rabbit hole of research articles, it's time to take a break. It's time to stand up, stretch, get some fresh air, walk outside, Do all of the things that every human needs to do. Get some good rest, get some good balanced diet going, some good balanced food intake, getting outside, getting some fresh air, doing some exercise. All of that will help a person cope with this whole multiple myeloma journey.
Thank you. Thank you for sharing those coping strategies. I think those will be really helpful. We know that myeloma care is costly, and it's not only the medications that are expensive, but also the additional costs that most people don't think about, like the hospital bills and the visits, the x-rays, the travel, the lodging, if that's needed, and possible supportive care measures. So Brittany, is the financial burden something that patients could raise with their care team when deciding on a treatment?
Yeah, so this is something that, again, we have so many great options, and that's why survivorship is, increased and improved in myeloma patients. But on the flip side, that is, how many more years are you paying for some costly drugs and medical treatment? That can take a toll on, again, we just talked about stress and mental health. That can be a huge factor that patients deal with. So the myeloma care is costly. Again, not just the medications, but all of the visits, the travel, lodging as your physician, in a different city. If you're going to see someone who's specialist, are you getting on a plane every single time you need to see them? So want to make sure that you're aware of all of the resources possible. So at the PNC, we are here to help guide you towards those specific resources. If you have an insurance provider, pick up the phone and you can talk to them about what specifically does my plan look like. There are other organizations out there that have staff that are able to really go through the ins and outs of those kinds of questions. So we want to make sure that we guide you to the right place to empower yourself with this kind of knowledge. Another great resource is your social worker at the hospital. They're able to deal with more of the psychosocial aspects, and one of those things is the financial burden, or what if you see it's a hot topic called financial toxicity. That's something that they talked about at ONS a lot. But what that means essentially is the burden placed on the patient and caregiver over the cost of dealing with myeloma long term. So making sure that you have, again, anyone, even if it's community support, look to local resources. Do you have, local community groups or, your religious affiliations, someone that can help fundraise in a time of need? Again, this is a situation where asking for help is the best thing you can do to empower yourself, because you want to make sure that you're able to deal with this long term. So this is something that, has just recently, again, become a topic of interest, I think, within the medical community. As Grace mentioned earlier, it's kind of shifting from treating the disease to treating the whole person. And this is a huge consideration that maybe wasn't thought of so much before. For example, the copay cost of Revlimid, which is one of the main therapies used to manage myeloma, especially in the maintenance setting, it can be very costly. So how do I manage that? And that's something that, you need to be, again, transparent with your team about, so that they can help utilize any resources. A lot of times the manufacturers of these drugs have different copay relief. Sometimes if you qualify, even a free drug program. Asking the pharmacist if there's any kinds of copay relief or coupons for certain therapies that they may have available. And again, applications for just outside funding, we're always able to help point you towards, but don't be afraid to ask, because that's something that, again, to be able to view myeloma and treat myeloma as a long-term and chronic illness, something that you'll need to be on therapy for quite some time. How do you do that fiscally is really, something that should be talked about more, and I'm glad that it is.
And I think, Brittany, you're correct. And it's tied a little bit to, again, the overall survival that we're seeing now with multiple myeloma patients. It may be that it is a newer consideration because we, years ago, did not see people do as well and live as long, frankly, as they are now. So that is why now it is definitely on the forefront of the whole care team's mind. How do we help a patient successfully go through these therapies and long-term overcome and thrive? So it is a big topic.
Grace and Brittany, thanks again for taking the time to discuss the topic of survivorship with me and our listeners here. This is such an incredibly important topic, and I hope that myeloma patients take some time after listening today to reflect on what is important for them to live a full and happy life and make a commitment to discussing their life goals with their healthcare team. Open and honest communication is at the heart of shared decision-making and can help patients not just live with their cancer, but live and thrive.
Thank you for listening to the Myeloma Matters podcast on survivorship, hosted by the Multiple Myeloma Research Foundation. The MMRF thanks Patient Navigation Center nurses Grace Allison, Erin Mensching, and Brittany Hartmann for their insights on steps myeloma survivors can take to better advocate for the best possible care with minimal impact on their quality of life. The MMRF also thanks AbbVie, Adaptive, BMS, Cure, Genentech, Kite Arcellx, Pfizer, Regeneron, and Sanofi for their generous support of this podcast, as well as Janssen Biotech, Inc., administered by Janssen Scientific Affairs, LLC, for support received from an educational grant. If you have questions about what you heard today, please call the MMRF Patient Navigation Center at 1-888-841-6673. If you've enjoyed this series, be sure to leave a comment or review wherever you get your podcasts. And thanks for listening.